Stress of the pandemic is evident everywhere, but perhaps no more so than in the hospital. That has led to a lot of patients and their families lashing out at healthcare workers. We talked to staff at Spectrum Health about the new campaign they hope will help.
I've had to call security multiple times on patients for threatening, for actually hitting, or, we've been hit at, kicked at, spit.
Being a nurse has always been a tough job that requires a lot of patience.
I will say that, though, through the pandemic, this has increased pretty exponentially.
You talk about mama bears and daddy bears. Well, this is a junkyard dog, and his teeth are out.
The pandemic has not always brought out the best in people dealing with the worst of challenges. Incidents of violence at Spectrum hospitals went up 24% from 2018 to 2019, then jumped another 57% the following year and 17% in 2021. Becky Cucci became a registered nurse right as COVID-19 started spreading in the U.S.
I can be as sympathetic as I can, but they're still aggressive, and I just would say, I don't have time for this.
She says even when there isn't physical violence, the mistrust from patients or family members eats away at her and creates a ripple effect in the hospital.
I can transfer you to my charge nurse, who then has to take away from the floor care because they're running around helping each and every nurse on our floor and trying to accommodate patients and move them.
Chief Medical Officer for Spectrum, Josh Koistra, says the problem became so serious they decided to create a new tool for hospital workers. It's a badge they all wear in case of emergency.
If a staff member is feeling like they're in a situation that's threatening or that there may be a need for security, they can just push any one of these three buttons on this badge, and then that will alert security that there is a need, and it also tells security exactly where that staff member is.
It goes along with a new campaign Spectrum has started sharing in the hospitals and in the community called Behind the Mask. It's a reminder that behind every medical mask is a person doing their best to help. Koistra says they also teach staff members de-escalation techniques so that their emergency badges don't become necessary.
These are things like talking to somebody with empathy, recognizing that their situation is challenging, recognizing the stress that the patient or family member may be under, because their loved one may not be doing very well, and acknowledging that it's okay to be frustrated and to have these feelings, but what's not okay is to take out that frustration and aggression on our team.
Despite the long days, constant overtime, and stress of this job, Cucci has no plans to leave.
That's why a lot of us still stay where we are, because we are a family, and God, I don't want to ugly cry, but we are a family, and that's why we not only have seeked out the resources that they've given us to talk to therapists, but my coworkers are my therapists.
And Cucci says small acts of kindness do go a long way in restoring faith, that they're making a difference as a medical worker. She said at the beginning of all of this, they were considered heroes, and that has just waned, and now they get a very different feeling from people.
You got to believe that politics is certainly playing a role in this, and it's just really unfortunate that these healthcare workers have become the punching bag.
That's what the hospital executive had said as well, with masking and visitor policy restrictions being at the center of a lot of these issues. But you can see what's in this new campaign, Behind the Mask, at Spectrum online. We'll have that for you at woodtv.com.
All right.